Suicide is always a difficult subject. We hear terrible stories of teens and young adults taking their lives, but you don't really hear about the largest group affected, senior citizens. The problem might be outreach to this group needs drastic improvement. 3 News Now investigator Jeff Van Sant delves into the little-known issue of elder suicide.
Ed is a simple guy.
Yeah, I don't care if it's 0 degrees out.
Loves his tea.
Got my tea.
And belting out his favorite tunes.
And how my coat and many colors was worth more than all the clothes.
But life isn't easy for Ed. He's facing demons, failing health, having family issues, and taking a mountain of medication. Stress, depression, anxiety. It's all becoming too much.
It was like I was running so fast. I hit a brick wall.
He tried to take his own life.
By that time, I'd already taken the complete full hand of sleeping pills. Then I took another full hand of sleeping pills. And I felt my heart, I could hear my heart go.
He's discovered and rushed to the hospital. Ed places a lot of his issues on his healthcare provider. Among other things, he says he's warned his physician about plans to take his own life.
I said, I'm tired of life. What do you mean? I said, you'll see. She knew, and she should know, as my doctor, I would think anyway, the state of mind I was in and what I was capable of doing. But no, instead, she chose to let me walk out the door.
For years, public perception has focused on teen and young adult suicide. But according to the CDC, the highest rate are men, 75 and older.
They're becoming more lonely. They're losing a lot of ability to do certain activities that they used to do. Maybe they've lost their spouse or a lot of friends. So there's a lot of different things that come into it for that generation.
Julia Hebenstreit is head of the Kim Foundation, a suicide prevention group.
It can be very difficult for the older generation to really open up and talk about anything involving mental health. It's a very generational thing. You know, younger people now they've grown up understanding how to process emotions and how to talk about them instead of bottling everything up.
Kelly Deneen is director of the Health Law Program at Creighton University.
For reasons we don't really understand, there are disparities in the way that elderly are treated in the healthcare system. Their symptoms are often not paid attention to the same way that a younger person might be.
That if the community has a high percentage of individuals who understand trauma and can respond in trauma-sensitive ways, then this will be a community where everyone can thrive and feel supported.
Jessica Croker is with the Trauma Matters Omaha and says there's a simple tool, a 10-question test called Adverse Childhood Experiences, or ACE. It asks about childhood neglect, abuse, traumatic situations in the household.
So for instance, an individual who has 4 or more of these adversities in their childhood is over 12 times more likely to attempt suicide in adulthood.
Experts hope more education will help seniors open up more and help future generations.
Hopefully, as some of these younger generations grow into the older generations, that they'll be willing to talk about it more and more.
For someone like Ed, he's faced lifelong struggles, an abusive father as a child, and molestation, issues that have followed him his entire life. He took that ACE test, scoring an 8 out of 10, putting him at extreme risk for long-term health issues.
And if we are willing to talk about it, that's the first step to being able to address and heal from these traumas and other issues.
For Ed, he's healing the rip with his family and belting out tunes to keep his spirits up, hoping that life will get better.
And did it my way.
Jeff Van Sant, 3 News Now.
If you need help, you can call the National Suicide Prevention Lifeline. That number is on your screen. For all of the investigative team stories, go to our website, 3newsnow.com. And if you have a story you'd like the team to look into, email them at investigate@3newsnow.com.